Vitiligo is an autoimmune condition where the immune system fights or attacks the melanocytes, and the melanocytes is what gives our skin its color. So in simple terms, the normal immune system fights the healthy skin cells called the melanocytes. When that happens, the melanocytes is no longer able to produce pigment in the affected areas, which turns to white, and this becomes very visible because there's a contrast between the areas of your skin where there's pigment and the vitiligo areas. Vitiligo can affect anyone regardless of age, gender, or ethnicity. And in this video, we'll talk about the causes, the triggers, as well as treatments available to make you more comfortable if you have vitiligo. Before we dive in, make sure you subscribe, hit the notification bell so you're not missing on any of our videos. Welcome to Dear Skin, where we empower you with education and knowledge on how to take care of your beautiful melanin skin. I'm Jackie Amafa. Let's get started. A huge factor of why you get vitiligo has to do with genetics, mostly 80% of the time. But you don't want to get hung up on that, because even with identical twins, one can have vitiligo and the other wouldn't. The other 20% has to do with environmental factors, which you can have some level of control over, unlike genetics. If you have vitiligo, chances are you have other autoimmune diseases or one autoimmune disease as compared to someone who doesn't have vitiligo. Thyroid disease is the one that is mostly associated with vitiligo. 15% of adults who have vitiligo also have autoimmune thyroid disease, and 5 to 10% of children who have vitiligo have autoimmune thyroid disease. So you always want to check your thyroid function periodically. Also, if you've ever had a bone marrow transplant or a stem cell transplant, you are 3 times more than likely to have vitiligo. So that's something that you would want to consider. It can also be a presenting sign if you are using treatments to fight metastatic melanoma, because when you think about it, the treatments are supposed to fight the deadly cancer within the melanocytes. If you see any patch like vitiligo on your skin, you need to pay particular attention to your skin, which can help you identify its development. Like how many times a new patch forms within a period can help you know its progression. Also, if any of the patches are becoming even more lighter, or you're seeing improvement from any form of treatment that you're using, or no improvement at all. Also, your doctor or dermatologist is likely to ask you any of these questions, so you want to make sure that you're putting them down in something, a journal or a diary or anything, so that you're not missing out on anything. It's always best to see a professional for proper diagnosis, because the first or early stages of vitiligo can look like other skin diseases. Vitiligo can appear in any part of your body, mostly areas that are exposed to the sun, like the face and the hands, and also places where you get a lot of friction, like the eyes, the nose, and the mouth. Anytime you have an injury, trauma, or friction to the skin, you can develop vitiligo in that area. So a cut, a burn, if you're constantly rubbing your eyes and nose, or you're constantly licking your lips. Also, areas where you wear tight-fitting clothing like the waistline, and when you get a skin condition that is associated with inflammation like psoriasis and shingles and so on. Skincare products also plays a huge role. You need to be extra careful with skincare products if you have vitiligo, because if you have an allergic reaction to any of the ingredients in the products, or if the product itself irritates your skin, you're likely to develop more vitiligo. So you always want to patch test products before you use it on your body. Profound stress, pregnancy, contraceptive pills, sunburn, etc. can all trigger more vitiligo. So you need to be careful of all these triggers. Your trigger might be different from someone else's, but you need to know your triggers and avoid them. The effects of vitiligo varies from person to person, and there's really no prediction on how fast it's going to grow or how white it's likely to get. But the thing is that it's more visible in people with darker skin tones as compared to lighter skin tones, because our skin is already pigmented. It is worth noting that vitiligo can repigment after treatment, but might reappear or extend again. So you always want to avoid the triggers, and you always want to make sure that you're on top of how your skin feels for the most part. Vitiligo cannot be cured, but there are treatments available that can help stabilize the condition. There's no specific diet when it comes to treating vitiligo, but you want to eat foods that are rich in antioxidants like red cabbage, dark chocolate, strawberries, blueberries, kale, beans, beetroot, spinach, etc. Because these foods help slow down the generation of free radicals that further damage the melanocytes, and they can also help you respond more to your treatment but not cure it. Topical steroids are good because they are anti-inflammatory. They are a great option if the vitiligo is progressing really fast and you want to minimize it. But the side effect is that it thins the skin and in some cases causes acne. So you don't want to use it for a prolonged period of time. Oral antioxidants like vitamin E and C are used as an anti-oxidation treatment strategy against vitiligo. There's also phototherapy, which is done by professionals, but the side effect of it is hyperpigmentation, increased risk of cancer, and erythema, which is the redness of the skin caused by inflammation or an injury. There's surgical treatments like tissue grafts, where a skin is taken from a part of your body where you have more pigment and placed at areas of your body where you have the vitiligo. Tissue grafts are more accessible because it's been around for a long time. It's also quicker and cheaper, but you need more bed rest post surgery. And also cellular grafts, where a culture of melanin is taken from areas of your body where you have more melanin or excess melanin and placed at areas of your body where you have no melanin. Cellular grafts are newer, they take longer as compared to tissue grafts, and they have fewer complications post-surgery, but they are more expensive and not as easily accessible as tissue grafts. They also lack long-term studies. Lastly is cosmetic approaches like cosmetic camouflage, so concealers, color correctors, etc. if it's really affecting your quality of life and self-esteem. It might take a bit of a practice, but once you get used to it, you should be fine. The most important thing really is not to irritate your skin. So you can ask your doctor or dermatologist to recommend any special cosmetic camouflage products that you can use anywhere that you are, as compared to other forms of treatment. But vitiligo isn't deadly. The downside is the psychological effects, because it can affect your self-esteem, make you feel very insecure about yourself, and also affect your quality of life. You should just be taking regular tests to see if you have any other autoimmune disease like autoimmune thyroid, because that is what is usually associated with vitiligo. Other than that, you're okay, you're fine, you don't need to worry about your health. But you need to make sure that you're wearing sunscreen religiously and also wearing sun protective clothing, as well as wide brim hats, because you want to cover your face from the sun most of the times if you're going to work in the sun for long hours, because the areas where you have vitiligo are more susceptible to the sun. And if you're watching me and you don't have vitiligo, vitiligo isn't contagious. I repeat again, vitiligo isn't contagious. You can't just walk by someone or touch someone who has vitiligo and get vitiligo. You need to offer a helping hand and be more supportive if you have someone with vitiligo around you. Don't shy away from them, because vitiligo can happen to anyone regardless of your age, your gender, or ethnicity. On the brighter side, if you have vitiligo and you're watching me, aside the fact that you might have another autoimmune disease, there's research that shows that people with vitiligo have a lower risk of certain skin cancer like melanoma, as well as other internal cancer, with the exception of thyroid cancer. So you're being protected by certain cancers, which is a good thing. I hope this video was informative and educative to anyone dealing with vitiligo. And if you're not, it's a good thing you know, because it might come in handy for someone else. So please share with anyone dealing with vitiligo. Hopefully this helps them out. Don't forget to like and subscribe to my channel for more content like this. And until next time, take care.